Hi, my name is Melina Moya, and I am going to talk about comprehensive molecular characterization of papillary renal cell carcinoma. First, the definition. Papillary renal cell carcinoma, accounting for 15% of renal cell carcinoma, is a heterogeneous disease consisting of different types of renal cancer, including tumors with indolent, multifocal presentation and solitary tumors with an aggressive and solitary, highly lethal phenotype. Little is known about the genetic basis of sporadic papillary renal cell carcinoma. No effective forms of therapy for advanced disease exist. Now let's see this video.
Papillary renal cell carcinoma is the second most common subtype of renal cell carcinoma. The most common is clear cell renal cell carcinoma. Papillary carcinoma usually shows predominantly papillary architecture, and it frequently has well-formed fibrous capsule. In this part of the picture we can see residual renal parenchyma. Here we have perirenal adipose tissue and this large papillary mass. This is papillary renal cell carcinoma. Here we have the fibrous capsule of the tumor, which is usually lined by the epithelial cells that resemble the tumor cells. The fibrous capsule in this example is not very prominent. It is usually thicker. Here we can see the papillary pattern of growth where the tumor forms these papillary structures lined by neoplastic cells with a central fibrovascular cores. It is not uncommon to see other types of growth. Here we have an example of glomeruloid structures that resembles normal renal corpuscles. Here we have a small area of solid growth, and here we have an example of tubular or acinar type of growth with a few foci that slightly resembles small glomerular structures. A very useful sign of papillary renal cell carcinoma is the focal accumulation of these foamy macrophages, also here and here. Alright, papillary carcinoma.
Now let's talk about application in medicine. This classification of papillary renal cell carcinoma in type 1 and type 2 may have a significant impact on clinical and therapeutic management and clinical trial design. The identification of altered genes and pathways provides a comprehensive foundation for an understanding of the molecular basis of papillary renal cell carcinoma. This refined classification more accurately reflects the genotype and phenotype differences among the different types of these tumors and should lead to more appropriate clinical management and development of more effective forms of therapy. Let's see this video.
In terms of non-clear cell, yeah, that's the problem with non-clear cell patient because nobody wanted to conduct any clinical trial on them because the market is so small, and they have no options. So that's the problem with those orphan disease. We have good drugs for clear cell, and we continue to conduct trials, very, very promising trials on clear cell patients, and then we move as I mentioned, we move the median survival for metastatic kidney cancer patient from 1 year now to 3 years, and I think in the future it could go easily up to 5 years. But those are for clear cell, but there's no company wanted to conduct trial because it cannot blame a company because the patient population is very small. It'll be very, very difficult to finish any meaningful trial within a reasonable time frame. So that becomes very difficult. So we always have to, rely on the off-label use of something. For example, we would really want to try the PD-1 or PD-L1, that kind of immunotherapy on non-clear cell, but there's no trial specifically for that because we have 4 or 5 different trials on clear cell with combination of immunotherapy, PD-1 antibody, PD-L1 antibody, CTLA-4 antibody, but we don't have any for the non-clear cell. That's the problem. But good thing is the PD-1 is approved for melanoma and hopefully get approved sometime soon for kidney. Then we can utilize those. There are two types of papillary RCC. One is type 1, one is type 2. Type 1 is very similar to chromophore. It kind of tend to be more indolent, but when they develop metastasis, they behave not as well. Type 2 is a bit more aggressive. Type 1 has been sort of hinted and related to c-Met signaling pathway. That's why MET targeting may offer some effective management of the disease. But having said that, we did a trial starting in 2010, and it's now maturing. We do see a combination therapy in our hands show very, very promising results against papillary type of tumor, which leads to our expansion cohort that what we're currently doing. And they may actually overthrow and then become the standard of care very soon. Hopefully, they will benefit many of the non-clear cell, including papillary patients.
Let's talk about pros and cons. Type 1 is often multifocal, characterized by papille and tubular structures covered with small cells containing basophilic cytoplasms and a small uniform oval nuclei. Type 2 is more heterogeneous, contains papille covered by large cells with eosinophilic cytoplasm and large spherical nuclei with prominent nucleoli. About the cons, kidney cancer or renal cell carcinoma is not a single disease, but it's made up of several different types of cancer characterized by different genetic drivers and each with a different histology, clinical courses, and response to therapy. Let's see this video.
PAPMED is a very interesting study that started out as a 4-cohort study specifically for papillary renal cell carcinoma. This is premised on the fact that type 1 papillary kidney cancers tend to have alterations in the MET oncogene. And so 2 of the 4 treatment cohorts were treated specifically with MET inhibitors, so with savolitinib and crizotinib. And then the 3rd treatment cohort was cabozantinib, which has both VEGF receptor activity as well as MET inhibition. And they were all compared to the control cohort of sunitinib alone. In papillary renal cell carcinoma, based on the ESPN and ASPEN studies, sunitinib had been the standard of care for these particular patients for a number of years. This PAPMET study was specifically looking at papillary renal cell carcinoma, and this is the first randomized study that's dedicated to this cohort of rare but non-clear cell kidney cancers. And so what we saw was that cabozantinib improved the median progression-free survival when compared to sunitinib in this setting. At an interim analysis, there were 2 cohorts of the study that were dropped, the savolitinib and crizotinib cohorts, because of lack of efficacy compared to sunitinib. And the final analysis was really between the cabozantinib treated patients as well as the sunitinib treated patients. And what we saw was that patients treated with cabozantinib had improved median progression-free survival when compared with patients treated with sunitinib. So based on this study, I think cabozantinib certainly has gained its recognition as the standard of care treatment option for patients with papillary renal cell carcinoma. And based on this, the study simultaneous with the GU ASCO presentation was published in the Lancet. So kudos to my colleagues and all the patients who participated on the PAPMET study and helped us learn about this very important non-clear cell kidney cancer disease type.
Now, let's talk about issue applied in Ecuador. Basic knowledge in aspects of epidemiology, screening, and survival was variable and heterogeneous, with a high frequency of errors in questions related to the prevalence of the disease and the sensitivity of diagnosis tests, 55% and 52% respectively. Cancer survival kidney disease with early diagnosis had the highest number of successes, perhaps because it is a generalized condition in most oncological pathologies. So, in conclusion, type 1 and type 2 papillary renal cell carcinoma are distinctly different diseases, and that type 2 papillary renal cell carcinoma is a heterogeneous disease with multiple distinct subgroups. Common driver mutations among the different subtypes were relatively rare, as had been observed in 2 recent studies. Molecular and phenotype differences between type 1 and type 2 papillary renal cell carcinoma were reflected in individual and combined analysis of various data platforms. Thank you.